This is a walkthrough of the educational binder I set up to pass around the classroom on the relevant sepsis information and breathe program that we've been talking about throughout the semester. Start with the pediatric sepsis portion. This is just the pediatric ED assessment tool for a patient that comes in with sepsis. This is what we're looking for in the ED. Now we'll go on to the doctor's order sheets just so the students can get an idea of orders that are placed for patients that are being admitted for sepsis. Pretty long order sheet, but this is what it is. And it just goes into the different types of antibiotics that are ordered based on protocol. Now next I have a pretty interesting article that I had found in the New York Times. It's just about a baby that was admitted with a fever and the treatment options that come up and how it's relevant in the clinical setting. So the students find this pretty interesting. I don't think it's going to pick up to read, but I'll try to. But if anyone wanted to look it up, I can always zoom in on the date and the time and the author there. It's a short article, 2 pages. Okay, next I'm going to move on to the Breathe program. And this is good because many of the students throughout the semester, not all of them, but some of them have had patients with asthma who are enrolled in the Breathe program, so they have seen this on the floor. Some of them haven't, but some of them have. So it just familiarizes them with the paperwork and what kind of teaching we're providing to the parents. Now this is the pamphlet that we send home with the parents about a guide to their child's asthma. Just goes through triggers and ways to avoid them. Frequently asked questions. Basically, it's what the students are learning in class is also what parents are being taught to go home. So it's a lot of education. And the students that I was able to work with in regards to this program definitely did benefit. They were able to just relay some of their own information that they know about asthma to the parents. And this is a little bit about the Breathe program, which is from the Asthma Coalition of Long Island. It's basically a long-term asthma management program. And it's an excellent program for the patients that are enrolled in it. It provides long-term management. We make phone calls to the parents at 72 hours from discharge. And then they go on monthly up to 1 year just to try to decrease the number of admissions of patients coming back into the hospital for asthma. This is just a paperwork from an agenda from an asthma meeting. I particularly find this interesting for the students because at my own hospital, I'm a part of the Breathe committee. And I found it interesting to see how it was run at another hospital, but this is just an agenda from my meeting that I had recently. And it really is an excellent program. This is how the flow sheet is, and it just shows that the whole, if you zoom in on the team here, everyone is involved. We have the residents, the RNs, pulmonary, respiratory therapists, child life even is involved with the teaching. It's really a whole multidisciplinary team approach, and it's excellent. And it gives the students an idea of how the team works together in the hospital, which is really important. And this is just the nursing admission questionnaire, which I also have on my PowerPoint, a summary of it. This is just another thing that's in the Breathe packet about the follow-up phone calls. Like I said, 72 hours. We do them at 3 months, 6 months, and 12 months. Some of the questions that are asked on the follow-ups. And now I get to the asthma action plans, which is great. It is for the parents as well as for the students learning. The students learn about it in class, but it's good for them to see it in action. We've had patients that have been given these asthma action plans and we've been able to review them. And the students definitely benefit from them. I also have this on my PowerPoint. And obviously the doctors are filling out, the information on which medication the child is going home on, how much to take, how often, and any other instructions. And they can make it individualized to each patient, which is great. On the bottom, they can know when to follow up with their doctors. And this is from like 0 to 5 years old. And then there's another one for 6 years and older, which basically takes into account activities and, children are more involved in sports, things like that. So that's why this action plan changes a little. And this was just a handout I had found that I thought was important for them from the American Lung Association. It's just ways for asthma to educate the parents on being at school and activities and how to prepare their children. And that's it. It's too much to read on this video, I would think, but I'll zoom in a little. And that was basically it for the book, for the binder. I just made this as a supplement. I thought it was important. There's certain, some students are more visual and they would benefit from this, seeing how it is hands-on and what's actually going on in the hospital setting. So I just found all the relevant information I can find for them that they could go through at their own time. I'm going to leave the binder around for the students. I did make copies of the asthma action plans, so they'll be able to look at them, on their own time and review before exams and just even before going into the clinical setting. Especially for those that are going into pediatrics, it's definitely going to be valuable for them in the future. Okay, I hope you liked this video. It wasn't too long. And thank you.